Hello, and thank you for joining us. As a Virginia Beach City or school employee or retiree enrolled in the Consumer Driven Health Plan, or CDHP, you may be eligible to enroll in the Health Savings Account, also referred to as the HSA. But what is a health savings account? Are you taking full advantage of it? In this video, we'll go over everything you need to know about the HSA to determine if it's right for you and make sure you're not leaving money on the table. If eligible for the HSA, this account allows members to receive an employer contribution, set aside money on a pre-tax basis for qualified medical expenses, and even invest funds when the balance reaches $2,000. Now, let's begin by determining your eligibility. In order to enroll in and contribute to the HSA, members must meet certain eligibility requirements. Please keep in mind that these requirements are specific to the account holder and not to the member's spouse or dependents that may be enrolled on the member's health plan. One of the eligibility requirements is that you must be enrolled in the Virginia Beach City or Schools Consumer Driven Health Plan, also referred to as a CDHP, which is a qualified high-deductible health plan. You may not have any other health coverage, such as being enrolled on another group plan, individual coverage, Medicaid, Medicare, including Part A, military benefits, or a medical flexible spending account, also referred to as an FSA. Please note that the restriction for not having any other health coverage is specific to you as the subscriber. If you have a spouse or dependent child on your CDHP plan that has other coverage, you remain eligible for the HSA if you meet all other eligibility requirements. It's also important to note that if you have a flexible spending account prior to enrolling in an HSA, all funds from the FSA should be reimbursed or spent prior to the effective date of the HSA, as no rollover of FSA funds are permitted when enrolled in an HSA. Another eligibility requirement is that you cannot be claimed as a dependent on another person's tax return. This does not include married couples filing jointly. If you answered yes to any of the requirements listed, you are not eligible for the HSA. If you answer no to all of the above questions, you are eligible to enroll in the HSA. So what exactly is an HSA? A health savings account, or HSA, allows you to save money for future qualified medical expenses not covered through your insurance through pre-tax payroll deductions or tax-deductible contributions if contributions are made directly into the account. An annual employer contribution is provided on a prorated basis throughout the calendar year to those employees and retirees that meet the eligibility requirements and elect the HSA. It is important to note that COBRA or PHSA participants are not eligible for employer contributions. Please visit our website at www.benefitsatthebeach.com for full details, including the employer contribution and annual contribution amounts. Now, let's go over what are the benefits of an HSA. HSA funds can be used for a variety of qualified medical, dental, vision expenses, and more. It's important to point out that funds in a member's HSA account may be used for their own qualified medical expenses, as well as for their spouse and dependents, regardless of whether their spouse or dependents are enrolled on the member's health plan, or if their spouse or dependents have other health coverage. Qualified medical expenses include cost of diagnosis, cure, mitigation, treatment, or prevention of disease rendered by physicians, surgeons, dentists, and other medical practitioners, and include cost of equipment, supplies, and diagnostic devices. Funds can also be used to pay for co-payments or co-insurance, deductibles, and other out-of-pocket expenses for services such as, but not limited to, hospital, urgent care, or PCP visits, chiropractic care, contact lenses, dermatology, fertility treatment, hearing aids, lab fees, prescriptions, prosthesis, therapy, vaccination, and x-rays. For a full list of eligible qualified expenses, please visit healthequity.com/HSA-QME or contact Health Equity at 866-346-5800. In addition, funds earn interest and can be invested in mutual funds when your balance reaches $2,000. All interest and investments are tax-free. As long as your HSA is being actively contributed to, the monthly administration fee is 99 cents. If there are no funds in the account, an administrative fee will not be charged and an account closure fee of $25 may apply. If you have an inactive account, There is a $3.95 monthly administration fee charged. An inactive account includes if you change health plans from CDHP to POS, do not re-enroll in the HSA, or experience another change where you are no longer eligible to contribute to the HSA. In this case, your account will remain open until you contact Health Equity to close your HSA. It's important to know that your HSA belongs to you and never forfeits, even if you no longer have an active HSA, no longer enroll in a qualified health plan, or leave employment. So, how do I enroll and how can I access my funds? To reiterate, you can receive an employer contribution regardless of whether or not you contribute your own funds to the HSA. Yes, you heard that correctly. You may elect the HSA and choose not to contribute your own money, but still elect to receive the employer contribution. So don't leave money on the table. If you're enrolled in the CDHP plan anyway, why not take advantage of the employer contribution if you're eligible? If you meet the eligibility requirements for the HSA, you can elect the HSA during the annual open enrollment, or you may elect this plan as a mid-year change. If you're a full-time employee or retiree, you can elect the HSA by logging into the Benefit Focus portal and select to edit your benefits. If you're a part-time ACA employee eligible for the HSA, you can elect the HSA by completing the Part-Time ACA Health Savings Account HSA election form found on our website. For more enrollment information, visit www.benefitsatthebeach.com or contact the Consolidated Benefits Office. After your HSA election is approved, Health Equity will mail you a welcome kit with a debit card so you can easily access your funds. Separate cards may be requested for each eligible individual utilizing your HSA. Thank you for taking the time to watch this video. We hope it helped you better understand the Health Savings Account, what it is, and how to make sure you are taking full advantage. For more information, please visit www.benefitsatthebeach.com/s/article/HSA. This page includes information we talked about in this video, plus helpful resources such as the HSA contribution calculator, HSA qualified medical expenses, HSA webinars, and more. For questions, contact the Consolidated Benefits Office at benefits@vbschools.com or 757-263-1060 or Health Equity at 866-346-5800. Thanks again for watching.